All right, on now to a wonderful team from the Urology Group. We've been working with them on a newer therapy for guys. Tell us a little bit about you, who you are and what you do.
I'm Brooke Edwards. I'm one of the urologists at the Urology Group. We're a group of about 50 providers that provide care throughout the tri-state area for all urologic causes for men and women. I'm also served as our chief medical officer for the group for the last 7 or 8 years.
So you handle prostate, bladder, what kind of?
Yeah, it goes on and on. Kidneys, adrenal, bladder, urethra, women's more vaginal issues, testicular cancer, kidney stones. It goes on and on. Hormonal problems.
It's wonderful to have a center sort of focused on that because those problems apply to so many people's lives. You don't know where to go for help.
It's very true. Unfortunately, a lot of people don't realize they need to see a urologist for those things, or they don't get referred maybe as quick as we'd like them to.
Yeah, I believe that. Well, we recently had the privilege of working with your team on something for benign prostate hyperplasia. It's called aquablation, and it is used to treat that condition, which can impact as many as half of all men at some point in their lives. Watch this.
Benign prostate hyperplasia is basically enlarged prostate, and so it gets more common as we age. Men in their 50s and 60s can start to have worsening urinary symptoms due to it.
To reduce those worsening symptoms, Dr. Aaron Bay here at Ohio's Urology Group was one of the first in the nation to use this aquablation therapy. As this animation provided by Procept shows, robotic-assisted ultrasound guidance helps a surgeon map out a plan.
Once this plan is all mapped out with using precision, the high-powered water jet of the robot ablates and gets rid of prostate tissue through the middle of the prostate.
This not only reduces symptoms, Dr. Bay says, but 5 years out,
their improvement statistically is much higher than medications or a lot of other procedures that we have.
So we sort of started exploring this and found that you were actually doing this procedure, but it is newer, one of many now for BPH, which is just one of the most common things you treat.
Yeah, urinary complaints obviously are very common for BPH specifically. It's as simple as an enlarged prostate, which is the gland that sits below your bladder, but it affects so many people. And the symptoms tend to creep up and are again common, but yet, as we said earlier, not harmful. They definitely can cause issues to other parts of the body as you age if you ignore those signs. So aquablation is a great example of one of the many procedures that we offer. It is one of our newer ones, so it is exciting. And just about every procedure that we offer has its pros and cons for a patient and fills in that niche that a patient may need as far as if they're worried about a specific side effect. So it's been a wonderful process to see over time that we've offered these procedures that fill in the blank for the patient that's looking for a very specific thing.
Well, we do have a little bit of the animation because people have, once you see it, you're like, wait, what was that? How does it work? But the idea is that so many of these guys say they don't want to take medications forever, and if you don't fix the problem, then you're just treating the symptoms. So is that sort of what this is doing?
100%. So the idea for this is to remove some of the tissue so that urine flow can increase. And some of the benefits of this procedure specifically is it has less sexual side effects. So for our younger patient and some of our older patients that's really important for, that's one reason why a lot of patients will pick this. It's also has some benefits for the larger prostate size because when we talk about an enlarged prostate, there are still, it's a wide range of sizes. So for the very large, this is a good option.
So, we wondered that, like, is there a good candidate, or do you need to get this before things get so bad that it can't be treated? Or
Yeah. So in our world, we follow people's symptom scores. So there's a specific validated survey that we ask all of our men to fill out before they come in just about every time they see us. And I'm sure it seems somewhat monotonous to fill out those same questions every time, but it gives us kind of a score and a grade that we can watch people over time at what point is important to intervene because we want to protect the bladder. And unfortunately, the problem is if you ignore your simple symptoms that you think are common and not a problem, you start having bladder damage and potentially kidney damage. and we cannot reverse those problems once they happen. Once that damage is done to the bladder, we can't get it, we can't fix it all the time. So we really want to address that before those problems become permanent.
You know, that's a really important thing, because you just think, oh, I just have to get up more often at night, or it's just uncomfortable, but there is an impact to the body.
Definitely. I mean, it affects sleep. It affects relationships with your spouse or family members. For many, it affects quality of life because it keeps them from traveling. They don't want to leave the house. You know, all those things. So it has a lot of mental health, just in general quality of life issues that it can cause damage to, in addition to our organs inside that we can't see, but it's happening.
Well, and what I love is we are now looking at the whole person like that. You never used to think about those things. It was just, well, treat the body.
Yes.
And the fact that we're now looking at this broader picture is so important. It speaks to our care. It speaks to your care. We want to make sure if you have an interest in this, or I know you have several other procedures to treat this and other conditions, you can find a link to the Urology Group at what'shappeninginhealth.com. Thanks for coming in and talking about some of the subjects that we say. Just because it's common doesn't mean it's normal. Exactly. And while this might not be a real comfortable conversation, like you said, when 8 out of 10 people are going to have it at some point in their lives, somebody's got to be talking about it.
Exactly. And we thank you for doing that.
Yeah, we appreciate you very much. All right, just ahead, could